Asthma by Gabby, Joanna, Ashley, Jalen, and Ben.
What is asthma? Asthma is a chronic disease that affects the airways in the lungs. It causes repeated episodes of wheezing, breathless, chest tightness, and night and morning coughing. During an asthma attack, airways become inflamed, making it hard to breathe. Asthma can develop at any age, but often starts during childhood. Many children with asthma experience their first symptoms before the age of 5, but it can also develop later in life, including during adolescence or adulthood. Some people may develop asthma in their senior year, but overall, asthma can affect at any age. Asthma symptoms can be triggered by various factors, including allergies, such as pollen, dust, and pet dander, irritation, such as smoke, pollution, strong odor, and respiratory infection, exercise, cold air, and stress. People with asthma need regular monitoring by a healthcare provider to assess their asthma control, adjust treatment as needed, and provide education support for managing their condition.
The history of asthma. Asthma is Greek, known for wind or to blow. Hippocrates, which are known to be the father of modern medicine, were the first to use the term asthma about 400 years before Christ. Belgium Jean-Baptiste found out that asthma was developed in the pipe of the lungs. In 1633 through 1714, Bernardino discovered that exercise had an influence on asthma. In 1874, Charles Blakely discovered that the main cause of hay asthma was pollen.
Introduction to the mechanisms of asthma. Now let's understand the mechanisms of asthma. Asthma, as a chronic respiratory disease, is characterized by inflammation and narrowing of the airways. Common symptoms include wheezing, shortness of breath, chest tightness, and coughing. There are underlying mechanisms that drive asthma's pathophysiology. Key mechanisms are airway inflammation. This includes immune cells that release inflammatory mediators, leading to swelling and inflammation of the airway walls, followed by airway hyperresponsiveness, which includes increased sensitivity of the airways to various stimuli, causing them to constrict excessively in response. Now comes along airway remodeling, which includes chronic inflammation that leads to structural changes in the airways, including thickening of the smooth muscle and increased mucus production. And the trigger factors of this include allergens, such as pollutants, respiratory infections, exercise, and stress. And these can exacerbate asthma symptoms by triggering inflammation and bronchoconstriction. Let's talk about inflammatory pathways in asthma, which include the role of inflammation in asthma. Here includes the inflammatory process in asthma, which involves various immune cells and mediators. There are key inflammatory mediators such as histamine, leukotrienes, prostaglandins, and cytokines. And we can't forget about the emphasis of the role of eosinophils, mast cells, T lymphocytes, and dendritic cells in orchestrating the inflammatory response. Now, the key mechanisms include mast cell activation, which includes exposure to allergens, which trigger mast cells to release histamine and other inflammatory mediators, leading to bronchoconstriction and mucus production. Next would be the eosinophil infiltration, where eosinophils are recruited to the airways by cytokines, which contribute to airway inflammation and tissue damage. Next, we need to talk about T-cell activation. The Th2 cells release cytokines that promote eosinophilic inflammation and LGE production, which further amplify the allergic response. Next is the neutrophil involvement. In some cases, which can be added Asthma may also involve neutrophilic inflammation, particularly in severe or steroid-resistant asthma. Now, these images illustrate the release and action of inflammatory mediators, as well as microscopic images which show inflammatory cells in airways, which include tissues of asthmatic patients. And last but not least, a chart / graph that depicts changes in inflammatory cytokine levels during asthma exacerbations.
The special focus part of asthma includes what happens chemically. When an individual is having an asthma attack, a chemical known as histamine is released. A histamine is a chemical messenger that mediates several cellular responses, one being the inflammatory and another being allergic reactions. Histamines indicate your body to constrict airways and create mucus, which creates wheezing following an asthma attack. During an asthma attack, the muscle wall contracts and the lining of the airways becomes swollen and inflamed. The picture on the left side represents a normal bronchial tube which shows relaxed smooth muscles and non-inflamed alveoli. On the other side, it shows an inflamed bronchial tube which has tightened smooth muscles making it harder to breathe, as well as an inflamed swelled lungs which has mucus or known as phlegm. The alveoli is also inflamed. When medications are given to prevent asthma attacks and allergies, it's called an antihistamine. The reason why it's called that is because when you're having an asthma attack, histamine is released, so you don't want that. In addition, asthma is a chronic airway inflammatory disease characterized by infiltration of the airway T cells. In both normal and asthmatic airway mucus, the prominent cells are the T cell lymphocytes, which are activated in response to antigen stimulation or during acute asthma exacerbations and produce high levels of cytokines.
With asthma, there comes various signs and symptoms. These signs may vary from person to person. Some people may get all of them, and some may get just a few. But some include shortness of breath, chest tightness, wheezing while exhaling, which is only common for children, trouble sleeping caused by shortness of breath, or coughing and wheezing attacks, which worsen when you have a cold or the flu. So all these symptoms may also worsen which when the air is cold and dry, or like you in work or and you around chemical fumes, gas or dust, and they can also be triggered by pollen, mold, and stuff of that nature.
Diagnosis and prevalence. A doctor will diagnose you with asthma by the following exams. They'll perform a physical exam. A physical exam can show hyperinflation, wheezing, and increased work of breathing, which can relate to symptoms of asthma. They'll carry out a lung function test where the patient has to breathe in a small amount of carbon monoxide and hold their breath for 10 seconds. When they exhale, the spirometer will measure the amount of carbon monoxide they exhaled. A blood test is performed to check the levels of a specific white blood cells known as eosinophils and an antibody known as immunoglobulin. If the results are high, it could be diagnosed as severe asthma. The chest and sinus x-ray is normally used to eliminate other conditions that aren't asthma. Asthma is found higher in adults and in females.
Now on to treatment and prognosis. The first treatment is bronchodilators, which helps to relax the muscles around the airways, making it easier to breathe during an asthma attack. They can be short-acting for quick reliever during acute episode or long-acting to control symptoms over time. The second one is corticosteroids, which helps to reduce inflammation in the airways, helping to prevent asthma symptoms and from asthma getting worse. The third one is combination inhaler. Some medications combine bronchodilators and corticosteroids in a single inhaler. Other medications, depending on the person's asthma severity and triggers, other medications such as nicotine modifiers, mast cell stabilizer, and biologics may be prescribed. Lifestyle modification, defining and avoiding asthma triggers such as allergies, irritation, and certain activities. Developing and following asthma action plan provided by the healthcare provider, which includes steps for managing symptoms and from asthma getting worse. maintaining a healthy lifestyle, including regular exercise, a balanced diet, and avoiding smoking and secondhand smoke exposure. The last one is regular monitoring, routine checkups with the healthcare provider to assess asthma control, adjust treatment as needed, and provide education, support, monitoring symptoms, and peak flow management at home to track asthma control and detect changes early with proper management and care. Most people with asthma can lead to normal, but asthma is a chronic condition which it typically doesn't go away completely.